But what beauty scientists have found that there is something in the structure of a beautiful face.
Hello, ma'am. How are you?
Hi, Purnima.
How are
Nice
you,
to see
ma'am?
you. I'm good. I'm good.
How is the
Tell me.
lockdown treating you, ma'am?
Lockdown is now getting a little tiring, both mentally and physically, but we have no choice.
How are you coping up with it, like a professional life?
So I've started working. I started working from June.
Yeah.
So I'm working part-time. I'm not working all day because we have to maintain social distancing and sanitizing between patients. So it's quite time consuming. So we're not working throughout the day. We
Yeah,
take
right.
clients only by appointment so that we do justice to everyone.
Ma'am, so let's start with your introduction. So
Yeah.
we have Dr. Kshitija Rao with us, who is a physician, and ma'am, we are very, very happy to have you here to have a conversation with you here. So let's start off with your introduction and what inspired you to become a physician in the first place.
Oh, that's such a long time ago. I have to recall that. It's like been so many years since I actually joined medical college. I remember it was in 1981, long time back. But yeah, I mean, there was no other option in my mind. I always wanted to be a physician, and I always wanted to do something in the medical field. Not that I have any family members who were doctors. In fact, I'm the first one, among my uncles or grandparents or parents who's a doctor. So it was quite a unique situation for me, but it's been a very interesting journey.
So they must be very proud of you, no?
Yes, they've all been proud of me.
Ma'am, so how has your journey been? How has your journey been? Has it been fruitful or has it been like steady go journey?
Oh, it's been very interesting. In fact, after my MBBS, actually, I did anesthesia. So I did my MD in anesthesia. Then I went to UK, where I did anesthesia and intensive care. And I was practicing as an anesthetist for many years. And then after that, I got interested in this field of beauty and aesthetics. So I had a friend with whom we partnered, and we decided to start a cosmetic center where we do treatments which are non-surgical. So we don't do any surgeries, but we do non-surgical treatments for anti-aging in terms like lasers, radio frequency. Then we do minimally invasive procedures like Botox, fillers, and also hair care. We're seeing a lot of patients with hair fall and hair problems at a very young age now. So yeah, that includes the whole field of skin and hair, and
Yeah.
some lifestyle advice also we give.
Okay. So it's a very inspiring story, very inspiring journey of yours. So I'll repeat
Yeah.
my question that how do you balance your personal and professional life? You are very graceful and passionate about your work, and it is a very hard work. So how do you balance it?
Well, luckily, when I started doing aesthetics, my
Yeah.
children were almost out of school. They were grown up, they were independent. And while they were younger, I focused more on, taking care of the family and my personal life. And once I realized that, they're independent and they can manage on their own, then I actually went full force into my professional life. Because I realized when you have a young family, it's very difficult to do justice to both. So I
Yeah, right.
decided that I'd let the professional side of me take a back seat while they were younger. And now that they're old and managing their own lives, I decided to be a little more focused on my professional life. So that has worked well, rather than do equal amounts at every stage in your life. I think it's very important to see at what stage of life you are before you decide how much you want to focus on at what point of your life. So life is a constantly changing thing, so you have to change along with it according to the phases in your life, and that's what I did.
And I'll take your advice personally too. It's really nice.
Yes. Yes, you can't
So,
have
ma'am,
one formula for every stage of your life. The formula has to change to be
yeah, right.
successful.
Yeah. Ma'am, so what kind of treatments do people come to you for?
So now in India, because of TV and because of the internet, everybody is aware of what treatments are there for anti-aging. So we have we have clients from all age groups. So the Younger ones come mainly for things like skin care, acne problems, hair problems, pigmentation. And the older ones come for treatments where, they want to slow the process of aging, or they've already started aging and then they want that process to be slightly reversed, or, they want to age more gracefully. So the treatments are divided into, the age group of the patient. And I must say that we do get a lot of male patients also coming in. A lot of men are also now aware of all this and are quite keen on doing all these treatments.
Okay. So, people of India, they are obsessed with the skin, the color of the skin. So, do people come to you for a fairer skin, for a brighter skin?
Yes, of course, because there are so many ads and, so much social pressure in India, to be fair skinned, that, having dark skin is considered a disadvantage. But in my practice, and of course, these are personal opinions, people have different opinions. But in my practice, I don't really encourage this obsession for fair skin. Because according to me, good skin has nothing to do with the color of the skin. Good skin is something that is smooth, which has a good texture, is flawless, doesn't have marks, doesn't have scars. And that is what the glow of good skin reflects on a person's face. And if you just are obsessed with the color of the skin, then I tell them that you're in the wrong place and I'm not going to encourage that. So I personally don't like to encourage this fair skin obsession.
Okay, that's quite good, ma'am. So what is a flawless skin according to you, ma'am? Do you like my skin?
Yes, you have good skin and you have a nice happy smile. So I think that's more important. A happy personality always reflects on the face. So yeah, if you're happy internally, definitely one looks much better. But yeah. See, a good skin is something that has a nice glow. It is smooth. There are no pits and bumps. There are no blemishes. So there are no acne marks, and it should be even toned. So what we do for people to get good skin is we do treatments like skin polishing, chemical peels. So when the skin becomes smooth, it glows. So it's like, I can give you the example of marble. The best Italian marble in the world. If you don't polish it, it doesn't shine.
Yeah.
It doesn't have a wonderful sheen. The same thing with skin. So if your skin is not smooth and it's not well polished, then it will not glow. So the whole idea of glowing skin is to make sure that it is smooth and flawless. And that is the idea of good skin, not the color of the skin.
Ma'am, I've also heard about Botox and fillers. What are these and what is the difference between them?
Yeah, there's so much in the media about Botox and fillers, right? So there's a big difference. People equate Botox and fillers into one category. So it's not as if Botox and fillers is the same thing. Botox is a treatment which is used for reducing lines on the face. Like, when you frown, like these lines would be treated with Botox. So if people want to get rid of forehead lines, frown lines, and what we call, crow's feet, then Botox is used to ease those lines and smoothen those lines. Whereas fillers are used for people to contour the face. So you must have heard of lip fillers.
Yeah.
Yeah, so a lip filler is used to make the lips feel full, or rather make the lips look full. So in the same way, a filler, as the name suggests, helps to restore lost volume. So fillers can be used to, for people who've become older and they have hollowing on the face, or if somebody suddenly lost weight and then they have sagging skin. So fillers can be used to add volume and contour to the face. So you can do lip fillers, you can do under eye fillers, you can do chin fillers, because now a pointy chin is in fashion. So you can do fillers even for the nose, you can do fillers for the jawline. The fillers are basically things that contour the face, and they are like a gel which is injected into the skin, and it can be done in any age group. So you can have young people coming for lip fillers and older people coming for fillers where they've lost volume and the face has started sagging. So that's basically the difference between Botox and fillers.
I thought there are fillers only on the lips. This is very informative for me.
Lip fillers are more discussed in social media, and what happens is, because a lip is a very sensitive area and anything done in that area becomes very obvious. So lip fillers can be detected very quickly. You can always tell somebody's done a lip filler, but a cheek filler or a chin filler are more subtle. So it's very difficult to tell that somebody's done a chin filler or a mid face filler. So, and the art of doing a filler is such that people should not notice that somebody's done a filler.
Yeah, right.
They just say that the person looks good, person looks fresh, person looks young. But the moment you can tell that somebody's done a filler, it means it's done badly. So filler should never be obvious. It should be very subtle.
Yeah.
And that's what I advise all my clients, that, there's always beauty in subtlety. Being very over the top is not very nice nowadays. So you have to be very natural and subtle.
Okay, ma'am. Ma'am, what kind of treatment do men come to you for compared to women?
So if you ask me as a percentage, I would say it's like an 80-20. 80% are women and 20% are men. And most of the treatments that men come for are hair treatments, related to hair fall or thinning hair. And they also do come for, anti-aging, or you have younger boys who come for pimples, oily skin, pimples, or they have scars on their face. So men also come for similar treatments, but the bulk of treatments men come for are for hair fall and hair thinning.
Okay. Ma'am, don't you think that youngsters are opting to go under the knife because of the beauty standards?
Yes, and that's quite an alarming trend, that people are getting so obsessed with their looks, and you need to have the perfect face, and you have all these filters on various social media platforms where perfection seems to be the only way forward. But we try and discourage that as much as we can. We discourage younger people from going under the knife, because now there are lots of non-surgical options. You don't necessarily have to have surgery, and with non-surgical options and some lifestyle changes, a lot of people can achieve what they want without really going in for surgery. There are certain cases where surgery is the only option, but then that is put on the back burner, at least for younger people. We don't really advise them to go straight away for a surgery.
Ma'am, even personally, I had acne marks all over my cheeks 2 months ago, and I started doing yoga. It helped me so much. It cleared all my face up. Yeah.
Oh, that's very good, because obviously your blood circulation, breathing, staying calm, de-stressing, all these things help.
Ma'am, so how do you deal with these youngsters, telling them if the treatment is right for them or not? They must be very stubborn about some things. Yeah.
Yeah, so I will always make a plan for them, because everyone is different. You can't have a same plan for different people. Everyone's lifestyle is different, everyone's thought process is different, everyone's skin is different. So each one is given a very customized plan, what will suit their lifestyle, what will suit their budget also, because these things also matter, and what will suit their age. Now obviously, if there's somebody who's an architect, who's out outdoors, standing under the sun, supervising, doing things, the treatment and the management that I would advise for her would be different from someone who is like a marketing person who's sitting, indoors on the laptop all the time. So everybody's plan is customized, and that's how we advise them. And that's how they agree to doing things, because they realize that what I'm advising them is for their own lifestyle, suitable to their lifestyle, their age, and their way of thinking.
Ma'am, it's good that they are able to understand, because I've seen these youngsters getting into peer pressure and going to the other doctor if some doctor has said no to them. So
that of course happens. That of course happens, because sometimes they don't like to take no for an answer. But if you want to practice ethically, and you want to feel that whatever advice you're giving them is for their own good, then after that you can't really monitor too much what they'll do with their life, because once they leave your clinic, then they are responsible for their own actions.
Yeah, your part is
I find a lot of people, if you make them understand, talk to them nicely, and give them a proper plan, then they're quite open to suggestions, and then they're not very stubborn about it. So it all depends on how you put things across. That is very important.
Ma'am, how do you deal with patients who are reluctant, as in they're hesitant about some treatment, or they're not sure about some treatment, because treatments can have side effects and people have sensitive skin? And also, if you use I started using dermatologist medicines on my face, and my face became so sensitive, and even if I put a normal Pond's cream, my face started burning. I couldn't put anything on my face for next 6 months. So how do you deal with them?
So each one's skin is different. Like I said, each one's skin is different, each one's lifestyle is different. And that's the reason why there are so many products in the market. Like there's not only one type of face wash, or there's not only one type of sunscreen. There are so many types. The reason is because there are so many types of skin. And sometimes what happens, it's a trial and error. Like we cannot predict what will suit you, what will not suit you. So sometimes we might prescribe something for someone and it may not suit them. But then the responsibility is for the client also to report back, saying that this did not suit me. So if they report back, then obviously we change it, because not everything can suit everyone. There's not, like I say all the time, there's not one formula for everyone. But the problem is that, people are impatient. So if something doesn't suit them, they think that, oh, the doctor didn't know enough. So then they change doctors. So that is something which we tell patients, that there are likely to be some problems, but you report the problems back to us as soon as possible, and then we'll try and sort it out. So you must have faith in your doctor, because most doctors, don't want to deliberately do wrong. But we cannot predict how everyone would react. It's like going to the gym, right? Somebody might go to the gym for 1 month and lose 5 kilos. Someone else might go for a month and not lose even half a kilo. So everybody responds in a different way. So you must have patience and you must have faith in the doctor. Like, sometimes I have patients who have dark patches on their skin. And when you ask them, how long have you had the patches? And they say, oh, I've had these for, 6 years, 7 years. And then you give them some cream to apply. And the next day they'll call you up and say, oh, I applied the cream and it's not gone. So how can you expect something which was there for 6 years to go overnight? Right? So people must have patience. And the problem is they see all these ads, on the net, when they show someone applying a cream and the next shot is of a flawless face. They don't realize that those are marketing gimmicks. You can't have that. So people do get pressurized by all these, marketing strategies, like on internet, on magazines, or, even on the TV, because they don't realize that they have to fit everything in a 30-second ad. So they can't show someone applying something for 2 months. But when you explain to them, I find most of my patients have been very reasonable, because my first consultation always takes at least 45 minutes to 1 hour. Because if you explain to them nicely, then they're not going to be worried when they, start applying things. And I think the first consultation with anybody is very, very important. So you need to spend that time for them to be able to trust you and develop a sort of a rapport and a bond, so that subsequently they don't get alarmed by anything that happens on their face.
Ma'am, so even if I move to Mumbai, I'll definitely come to you for my skin problems if I have any. And I hope you remember me.
Nowadays, of course, and now there are a lot of online consultations happening, so you don't have to move to Mumbai also.
No, ma'am, I was doing my college there, so I have to move back there.
Okay. So what are you doing?
Ma'am, I was doing BCom honors from HR college.
Okay.
Yeah. Ma'am, so I read your article. So I want to understand that what is the combination between mathematics and beauty? How are they related?
That's a very interesting question. Now, most people think that, beauty is random. And most people think that the concept of beauty across different cultures is different. So they feel that if you go to China, the concept of beauty and what they call beautiful is different. If you go to Africa, it's different. If you go to, Germany or America, it's different. In India, it's different. But what beauty scientists have found, that there is something in the structure of a beautiful face that is common across all races. It has nothing to do with the color of the skin. So the structure and the proportions of the face, which is called the golden ratio, and it's also called the divine proportion, which means that when a face is proportionate, it looks beautiful. That is, and this golden ratio they found even in nature. They found it in the petals of a flower. They found it in the galaxy, in the universe. And they found that even ancient architects and scientists, when they were designing monuments like the Taj Mahal or the Leaning Tower of Pisa, all these architects, they made things in the proportion of the golden ratio. And that's why these monuments are so beautiful. So that is what we mean by there is mathematics in beauty. So when we do treatments, we try and bring the face as close to the perfect proportion as possible. So if somebody has, beautiful lips, but they have a very short chin, then the face doesn't look structured, it doesn't look contoured. So then we'll work on the chin to give it a beautiful proportion. And eventually, it's all proportions that give you beauty. Like everybody on this earth, everyone in the human race has 2 eyes, 1 nose, 2 lips, 2 ears. We have a forehead, we have cheeks, and we have a chin. So what makes someone Miss Universe? What makes them different is the proportions on their face, the distance between the eyes, the shape of the nose, the shape of the lips, the size of the lips, the proportion between the lips and the chin, the proportion between the cheek and the nose. So these are the proportions that make someone from average to a wow looker. So these are the kind of proportions we need to work on when we are doing treatments for people, especially Botox and fillers, to get them as close to the perfect proportion.
Okay.
So that is what we mean by mathematics and beauty.
Now, so this was my last question, and do you want to give us some suggestions and tricks and tips or any extra information from your own side?
What I would like to advise people is that be mentally and physically happy. Don't focus only on the external. It is important because that's what we project to the world. But it's also important to be satisfied with yourself from within and not to be obsessed by your looks. So we always encourage people to take care of themselves. We encourage people to look good. We don't say that it's not nice or it's not good to want to look good, but it's not good to be obsessed by it. And in terms of anti-aging treatments, it's good to start early, take care of your skin, take care of your hair, take care of your lifestyle so that you age gracefully and you age in a better way. And for those who need it, we always have treatments in the clinic which are now safe, they're reliable, and they're effective. So trust your doctor to do the best for you, and don't be obsessed and don't have social media pressures, because then that could make you miserable no matter how good you look.
Yeah, right. Thank you so much, ma'am, for connecting with us. It was a pleasure having you with us.
It was a pleasure talking to you, and hope we can have many such talks.
I hope we reconnect again.
Thank you. Bye.
Thank
Have
you
a
so
nice
much,
day.
ma'am. Bye.
Stay safe. Stay safe is the main message now.
You too, ma'am. Take care.
Thank you.
Bye.
Thank you. Bye.